there are 100 cases in all over the world, 26 cases are from India. So such a high burden country we are having. And if you'll ask me, Mumbai and Peri-Mumbai area, that is Mumbai and Thane Municipal Corporation, have the maximum highest number of tuberculosis patients. In 2019, we almost had 79,144 deaths due to tuberculosis. All over the world, it is the around 1.8 millions of people have died because of tuberculosis.
अगर कोई आदमी अपने लाइफ में इस बात को उतार ले, उसका पालन करने लगे कि वो रोज सुबह उठे 4 बजे, 4:30 बजे, 5 बजे भोर में, और उसके बाद वो 10, 15, 20 मिनट, आधा घंटा टहल के वो योगा कर ले, अच्छा योगा का एक पैकेज अगर वो कर ले, वो कभी जिंदगी में बीमार नहीं हो सकता. यही प्रिवेंशन है.
Next, we will go on to the bronchial mudra, which is direct relations with your bronchial system, your respiratory system. Here is your hand. The middle finger is pressed.
Very warm welcome to Panashi, everyone. Panashi, as we know, that one goal, many approaches helping in overcoming our COVID-19 situation, pandemic which is going on. And in this session today, I welcome Ms. Shohini Roy Chaudhary again for her yoga sessions. I welcome you, ma'am, to the session today. I will leave the virtual dais to you, and you can conduct your session as you've been doing this for many months now. So I'll get back to you again, ma'am, for the same.
Good morning, all of you, and thank you, Beatrice, ELETS, Narayana Health, for starting Panacea, a platform that actually looks into overall health and healing of the nation. You know, all of you, that we are going through very difficult times, especially in India, with the COVID variant that has created havoc, and all we can do is fortify ourselves. Besides vaccinations are necessary, of course. One has to wear a mask, keep social distancing, but also we try to fortify our own system, our own resistance, which can be done with eating right, sleeping well, by hydrating the body as much as you can in summer, and with your yoga and cardio regimen. Yoga, as you know, helps the body and mind to be resistant, as we have to fortify our lungs for maximum intake of oxygen. For that, besides your exercises, besides all of it, it is very important to keep our windows open. Being cooped up in a room with an air conditioner or keeping your windows and doors closed is not a good way to build resistance. So try as much as you can to keep your windows open and be in an open space. Difficult in urban life, but we can at least keep our windows open, all of us. I would start with some pranayamas and asanas and mudras with the hands, but I would also like to say that our ancient yoga culture tells us that if you are not well, if you're not feeling well, the slightest hint of flu or a cough and a cold or a sinusitis attack or fever, you should not do your pranayamas or asanas. Only when you're feeling 100% normal should you be able to do it. Same goes for pregnant women and for women who are going through menstruation. These are things we've learned in our country. Though in the West there are yogas for pregnant women and for all kinds of things, but we don't believe in that. Those are marketing fads. So the basic rule is, if you're pregnant, if you're menstruating, or if you've got a light flu or fever, you should not do your asanas or your pranayamas. Build up your resistance, and this is only to be done when your body and mind is feeling completely normal. I will start with our pranayamas because it is very important to breathe right and to take in oxygen in our body. It's the only chemical that cleanses us totally, the only organic chemical, and it detoxifies our body. It's a body spa and a mind spa. It also energizes you, fights anxiety and depression, panic attacks, nervous breakdowns, and helps you feel confident, feel energetic, and feel dynamic. So first, I will start with the bellow breath, where you breathe in and hear the sound. Breathe in fully and breathe out more strongly. Breathe in, breathe out. How you deal with your abdominal muscles when you breathe in and breathe out is very important for your pranayamas to be effective. When you breathe in, loosen your stomach. Let your abdominal muscles go. So you puff out your stomach and take in as much as air as you can. See? When you breathe out, your stomach goes in. You pull in your abdomen. It's as if you're trying to touch your navel to your spine. It is very important. Breathing is something we take for granted. It's a natural procedure. But when you're doing pranayamas, it's better to do it mindfully, to do it consciously. So when you breathe in, you let go of your stomach, puff out your stomach. So you take in the maximum oxygen into your lungs, and when you breathe out, you pull in your stomach. In bellow breath, when you breathe in, imagine you're smelling the fragrance of your favorite flower. When you breathe out, it's as if you're trying to blow away a leaf. So you know exactly the strength of your breath. Now I shall start the bellow breath. You can sit in Sukhasana, which is just crossing your leg and sitting if you're comfortable. And if you're up to it, you should do it in the Padmasana, the lotus, which is very good for your lower back and your spine health. And automatically facilitates breathing. Your spine health being assured, it helps you breathe better. I'll do it at Padmasana. Right leg over the left thigh. Left feet over the right thigh. Here's your Padmasana. The hands in the Jnana Mudra, which means your thumb and your index fingers are touching each other, and on your knees like this, the hands put on your knees like this, and we do the bellow breath. We must do 50 of them. You could do 150 for it to be effective. So breathe in, breathe out. Breathe in, puff in your stomach, puff out your stomach. Pull in your stomach, breathe out. 3, 4, 10 over. I think you're all doing well. 10 more. Breathe in, loosen your stomach muscles, let your abdomen go. Puff out your stomach. Breathe out, pull in your stomach. 6, 7, 10 more, so we are at 20, 30 more. As you breathe in, puff out your stomach. As you breathe out, contract your stomach muscles, pull your stomach in. So while you're breathing well, this is also going to work on your stomach fat, your stomach muscles, and doing it regularly, you'll get a slimmer waist. Finish. Now we'll do 10 more for 40. Pull in your stomach. When you breathe out, Puff out your stomach when you breathe in. Breathe in deep. Breathe out with force. Breathe in as if you're smelling the fragrance of a flower. Breathe out as if you're going to blow a leaf away. You're doing good. The last 10 to finish bellow breathing. Breathe in, smelling the fragrance of a flower, puffing out your stomach. Breathe in all that oxygen into your lungs. Breathe out in a stronger manner as if you're blowing away a leaf. Breathe in. Breathe out, contracting your stomach. Breathe in, puffing your stomach. Breathe out, contracting your stomach. Breathe in. Breathe out. 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 7, 8, 9, and 10. You will feel your body more energized. A lot of oxygen has entered your body. Keep your windows open. Ideally, you should do it in the morning. And pranayams are not to be done if you have even a slight flu or fever, if you have high blood pressure, if you are pregnant, or if you're menstruating. Please keep that in mind. This is what our ancient Yoga Vidya tells us, regardless of doing pregnancy yogas in the West, which is a fad and which is not an authentic part of our yoga. Next, we will do the alternate breathing, where you breathe in, your fingers, you hold your ring finger and your little finger and your thumb pressed to your right nostril. Breathe in through the left nostril, deep breath. Release the right nostril and breathe out. Breathe in through the right nostril. Breathe out through the left. Breathe in through the left. Release your right nostril. Breathe out. Breathe in now through the right nostril. Cover it with your thumb. Block it with your thumb. Release your left nostril. Breathe out. This is the pattern. And as you breathe out, automatically your stomach swells. You let go of your abdominal muscle. Stomach puffs up, puffs out. Breathe in. Take the maximum amount of air in your lungs from the environment. And when you breathe out, your stomach contracts. You pull in your stomach. However, whichever pranayam we might be doing. And it is very important to keep your windows open. Windows closed, your room will have a limited amount of oxygen. Limited because you're restricting the airflow. We need the flow of air into any room for you to keep on breathing oxygen. This is also happening to COVID patients where they get oxygen concentrators at home, but after a while they still need to get hospitalized because they have kept their windows shut. So the oxygen concentrators can't do their jobs. Because you need this fresh flow of air for an oxygen concentrator also to give the COVID patient oxygen. So please remember the golden rule: with or without an oxygen concentrator, during yoga, during as much as you can, all times, keep windows open for the flow of air, because you need your air to be recycled for you to get fresh supply of oxygen. Next, you can sit at Sukhasana. I will sit in my Padmasana by alternating. Now, put the left feet on the right thigh and the right feet on the left thigh. One hand, the left hand is in Dhyana Mudra as before. On our knees like this, facing the ceiling. Our right hand, the thumb is pressed to the left nostril. The index finger and the middle finger are folded in, and the ring finger and the little finger are out to press the left nostril. Now, we block the right nostril, breathe in deep through your left nostril, puffing out your stomach. Long breath. Now restrict the left nostril, release the right and breathe out. Breathe in through the right. Deep breath. Block the right, release the left nostril, breathe out. Breathe in through the left. Deep breath, breathe out. Breathe in. Breathe out. Breathe in. Breathe out, pulling in your stomach. Breathe in, puffing out your stomach. Expand. Breathe out. Breathe in, puffing out your stomach. Block the left nostril. Breathe out, pulling in your stomach. Continue for 50 rounds. You can do it for 150 to 200 or even 500. I can't do that much because we have restricted time, and then I would like to do more asanas with you. But I'll do up to 50 counts. So those of you watching, today your yoga regimen would be perfect. But when you're doing it by yourself, please do it for between 100, 200 or even 500 for optimum results. And you'll see how your mind and body health improves in a week. Also, for elderly people who can't sit on the floor in your Padmasana or Sukhasana, you can sit on a hard surface, on a chair, or on a sofa, or on your bed. People with back problems, people with orthopedic issues. You can even do your pranayamas while you're watching TV, while you're waiting for something, with just breathing right. And as you will see, naturally if you're breathing, your stomach puffs out when you breathe in, when you inhale. And when you breathe out, your stomach muscles go in. So this will become a natural process soon when you're breathing mindfully. So now we go on to our alternate breathing. All of you ready? We start. Breathe in. Breathe out. Twenty. That's 30. 20 more. Pull in, inhale, puff out your stomach, exhale and pull in your stomach. That's 40 complete. We'll do 10 more. This really fights fatigue, fights nervous attacks, panic attacks, depression in a big way, and helps clear out your nostrils, helps clear out your mucus and your sinusitis and your sinus channels, and opens up your Anahata chakra, which is the chest chakra, and takes in oxygen right to energize your body and balances your chakras, balances your energy flow. We do the last 10. Remember to breathe in fully, breathe in fully, strong inhalation, take in a deep breath, take in all the oxygen that you can from the atmosphere. Breathe in and pull in your stomach and breathe out. Breathe in deep, 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 pull in your stomach, breathe out. Breathe in deep, puff up your stomach. Take in the oxygen into your body, breathe out. Breathe in deep, 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 breathe out. This should actually make you feel quite heady with oxygen, because a lot of oxygen is entered into your body with mindful breathing from the environment. Next, we'll do the third form of pranayama, which is the restricted breathing. Here you can sit in your Vajrasana or your Sukhasana, and I will sit in Sukhasana. You will feel each time you breathe in very deep, then hold it for 2 seconds, breathe out, restrict it by pulling in your abdominal muscles. This is the Kapalbhati. Here you have in the Jnana Mudra, your left hand, the palm rather, is over the left knee. Feel your stomach, breathe in deep, breathe out. In 10 puffs, you should be able to breathe out what you breathed in. Inhale again. Exhale in a restricted manner. Pull in your stomach. Breathe in. Breathe out. Breathe in. Puff out your stomach, fill your lungs with air, and breathe out in short spasms, pulling in your stomach in short spasms of 10 or 5, as much as you can do. Deep breath. Short spasms, breathe out, pulling in your stomach each time, trying to make your navel touch your spine. If you can't do more than 3 or 5, that's perfectly alright. With more yoga practice, you'll be able to do 10 or even 20. Breathe in, breathe out. 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 You should be able to do about 100. We will now do some asanas. Stretch out your legs right in front. You need to stretch as you've been sitting in Padmasana or Sukhasana for so long. Here you go. You can see the soles of my feet. Stretch it in such a way that your underneath your knee is pressed to the floor. Kick your hands right up, lock in your fingers, breathe deep and touch your toes. If you can't touch your toes, go down as much as you can. Or if you're more flexible, wrap your fingers around your feet. Breathe in deep, go down and rest your forehead on your knees. 4, 5, 6, 7, 8, 9, 10. This opens up your chest, as I said, the Anahata Chakra, and really helps the respiratory system, helps the cardiac system, and helps to open up your respiratory channels within your body to take in oxygen well. Once again, please repeat. Here, lift up your arms as much as you can, stretch it. Lock your fingers together and breathe deeply, elongate your spine and touch your toes. If you can't, touch your knees. Come down as much as you can, or if you're adventurous, wrap your fingers around the underneath of your feet, rest your forehead on the knees and count 10. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. We do it once more before we change to other stretchings that helps your Anahata Chakra, that helps your respiratory organs, that helps your respiratory tracts to be cleared, especially in the morning, so you breathe better. We had never thought about oxygen inhalation till the COVID-19, when you know that something we take for granted is so vital for us. Come down, elongate your spine, breathe deeply and count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we'll do some other stretches. Elongate your legs, stretch your legs out. I'm going to touch my right leg with my right toes, rather with my left hand. Here we go. Hand behind the ears and touching it. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Here we go. We repeat it on this side. Here we go. Hand behind the ears, stretch out. Keep your head on your knees. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This really helps your lower back. It elongates your lower back and keeps spine health. Beyond, also of course very vital for your respiratory organs, your respiratory tract, and it channelizes the oxygen into your body and helps you breathe better. Here we go. Once again, hand behind the ears. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. One more time. On the left leg, hand behind the ears. You would feel your spine stretching, you would feel your sides stretching, and this is very good also to reduce inches around your waist, on your sides, and also ensure good health for the respiratory organs. Here your hand goes behind the ears. We repeat. 1, 2, 3, 4, 5, 6, 7, 8, 9 and up we come. One more time to do a cycle of 3. Ideally, when you're doing your asanas, if you do everything for 3 counts, it's a good way of doing things. Here, up, and here we go. 1, 2, and you feel your body stretched. Initially you might feel a few little creaks and aches and pains there, but your muscles expand, your chest expands, helping you breathe in much better. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Here up you go. You should be feeling a bit better. Now we are going to do a couple of asanas which are recommended to create a resistance for the respiratory system. The lungs, makes our lungs stronger, helps us keep tuberculosis at bay, and also if you've already suffered from tuberculosis, it helps the healing process, it helps making you as resistant once again. But however, if you're afflicted or diagnosed with tuberculosis, you have to go to the doctor for medication. This just supplements your heart health, your lung health, and helps you build more resistance within your body. For tuberculosis, one very important asana is the Tadasana, which is the mountain climbing position. I think you can see me, all of you, hopefully. Where we take a deep breath, stretch out our arms like this on top of our heads, and stand on our toes. So, to optimize the inflow of oxygen into our bodies. And with our bodies completely stretched and our respiratory organs, our respiratory system benefiting. Here we go, and 1, 2, 3, 4, 5, 6, 7, 8, 9, and we come down. Inhale again deep and get into Tadasana posture. Hands are up here, fingers interlocked, arms completely stretched, spine elongated, and stretch out. Stand on your toes with your deep breath, count 10, and then as you inhale, as you exhale, come down. Inhale deeply. 5, 6, 7, 8, 9, and exhale. One more. Hands above your head, stretched out, spine elongated, feet firmly on the ground, gripping, fingers interlocked. As I breathe in, I stand on my toes in the mountain posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, and exhale. Next, I'll go on to the Trikonasana, which is the triangle. Spread your feet to, there should be 3 feet of gap in between. The right feet turned outside as if you're going to walk off here. And here are your arms straight at shoulder level. Left arm goes up towards the ceiling, and you bend and touch the floor and look at your raised arm, look at the ceiling, and you need to keep this for 1 minute for it to work well for you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I'm doing it shorter because we run out of time. But when you do it, you need to do this for 1 minute because this is very good for your kidneys, liver, and lung. But it needs to be, you need to stay in that posture for 1 minute and do 2 cycles. This is the Trikonasana. Now I'll repeat it with my left feet. Now turn the left feet outside as if you're going to walk off this way, and your arms at shoulder level, straight here. Pull in your stomach, tighten your body, elongate your spine. Lift up your right arm towards the ceiling and left arm here, and look up at your raised hand. Look at the ceiling. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. That is your Trikonasana, which is very good for your kidneys, your liver, and your lungs. So Trikonasana is a must if you want to create more resistance against tuberculosis. And as I said, if you've suffered already and you're healing, this is an absolute must. Next, we will get on to some of our floor work again. The Bhujangasana, the cobra, is also recommended for tuberculosis. It's definitely an asana that aids in creating resistance for the lungs and helps you breathe better. Rest your arms on the side. Lie flat on your stomach, on your mat. Then bring your palm at your shoulder level, at the level of your shoulder, close to your body. Close to your body. Grip the mat firmly with your hands. And then raise your body up to your navel, straight. So your arms are straight, and this is the cobra. Your feet are joined. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Go down slowly. Arms by your side for 5 seconds. Come up again. See, your feet are joined together. Feet are together. Palm is near your shoulder blade, right here. Close to your body. Grip the floor tightly, firmly with your palm. And raise your body. Cobra posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, and down. One last time, Bhujangasana. Shoulder blades and hand palm are on the same level, close to your body. Grip the floor mat tightly with your arms, feet together, and raise up to your cobra posture. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This also tones your chest muscle, tones your stomach muscles, and is very good for creating resistance of the respiratory system, of the cardiac system, especially of the lungs. And this also can be very good to cure backaches, lower backaches, and spine health. We go down now. We will next do the Dhanurasana, which is the bow posture. Dhanurasana also is one of the recommended asanas for tuberculosis. Hands by your sides. Lift up your legs. Hold on to the toes or ankle, whatever is easier for you, and raise your body. Count 10 and bring it down. Rest for 5 seconds. Repeat again. Fold in your feet. Hold on to your ankle and raise your body in the shape of a bow. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Rest for 5 seconds. 1, 2, 3, 4, 5. Come up in the tabletop posture. Here we are. In the tabletop posture, we are going to do the Shishu Asana, which helps expand your chest and is good for your respiratory system, also relaxes your body, stretches your body. Here we are, feet together, knees sitting, and stretch out your arms and rest your forehead on the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9 and come back to tabletop posture. We will repeat once again. Kneel sit from the tabletop. Kneel sit. Stretch out your arms and keep your forehead on the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. I think all of you are doing very good. Now we will go on to the puppy posture, which is from the tabletop we kneel stand, we don't kneel sit. And we stretch out our arms. We stretch out our arms as much as we can and rest the forehead on the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Get back to tabletop. And we repeat. We kneel stand on our knees and we stretch our arms in front of us and rest our forehead on the floor. Hands press to the floor. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. That is the puppy posture. This is the tabletop. Now we will go on to the downward dog posture, which is very good again and a recommended yoga asana. Here we are from the downward dog. From the tabletop, we go on to the downward dog. Get up and put your feet on the floor. Hands, head should be between the elbows. This is your downward dog. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Get onto the tabletop posture once again. Rest for 5 seconds. 1, 2, 3, 4, 5. And we go on again to the downward dog. Here we are. 1 and your head is between the elbows. Take it as within as you can. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. The downward dog. We will now go on to the bridge posture, which again is one of the foremost asanas recommended for tuberculosis. Lie on the floor on your back, arms by your side, and legs folded in with the distance of your hips in between. Here, they are not close together like this. They are distant from each other, about 1.5 feet or so. And now press the shoulder, press your arms to the mat tightly so you have a good grip and lift up your body as much as you can. Here we go, bridge posture. Here you will see the gap here, the bridge is created over here. Here is your bridge here. 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. Lower your body, stretch out your legs. 1, 2, 3, 4, 5. Once again, Folding your legs, not together, but at a distance of your hips, about 1.5 feet. Grip the mat tightly, grip it well with your hands and your shoulder blades firmly on the ground. Press it firmly on the mat and lift up your body. 1, this is the bridge posture. You can see the bridge here. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now, relax for 5 seconds. 1, 2, 3, 4, 5, and get up on your mat. In yoga, you don't get up suddenly like a spring. Turn around and get up with your hands. So there's no direct flow of blood into your brains and you feel dizzy. Get up gradually from the side. The bridge posture, as I showed you, those are the recommended yoga asanas for those suffering from anxiety and depression, certainly, but those are the recommended asanas for tuberculosis to keep it at bay. And if you've already suffered, so next we are going to do a couple of mudras, which will again, mudras, as you know, is healing at your fingertips. Each time you press a particular finger to another finger, various channels of energy within our bodies get accentuated, gets a flow of oxygen that helps to balance various channels of our body, of the nervous system, of the cardiac system, of the respiratory tract, and all of that. So I'm going to show you some mudras which actually are very helpful, like the pranayamas. If you do it for about 10 minutes a day, in 7 days, you will see the effect. And it is something that can be done by everybody, young, old, those with back problems or orthopedic problems, and sitting in any surface. You could be traveling in a flight and doing it. You could be in a car, in a traffic, you could be doing it. You could be watching TV and doing it. And so it's like a self-healing kit for you that you can do yourself at any time, at any place. First, we are going to do the Brahma Mudra. Here are your fingers, fold it in a fist, thumb outside, and press it like this. This is supposed to be very good for your nervous system. This is very good for your heart health and your lung health also. This can prevent bronchial attacks, this can prevent asthma attacks, and helps you breathe better. Because it's your nervous system, you know. Bronchial issues, asthma issues, our breathing issues are very related to our state of our minds. If we are stressed, if we are nervous, if we are panic-stricken, if we are very anxious, it triggers off asthma attacks or bronchial attacks, besides allergies. This really helps you fight all those allergic reactions and helps you breathe better. This is the Brahma Mudra. Thumb out. Here, your fingers are rolled into a fist, thumb wrapped over and pressing them to each other. See, my shoulders are not like this. Up here, and spine is elongated. Sit straight and do that. This is the Brahma Mudra. Next, we'll go on to the Bhairava Mudra, which is the Shiva Mudra. As you know, the Shiva is related to Tandav. So this is to energize your body. General feelings of anxiety, depression, lack of energy, lack of willingness to work, just a lot of lethargy or fatigue, this helps. Right hand over left hand. And you must remember to keep your shoulders very straight. You can't droop. It can't be like this. Keep it absolutely like this. This is the Bhairava, the Shiva Mudra. That energizes you. Once again, right hand over left hand, that is the Shiva Mudra, the Bhairava Mudra, which is automatic flow of energy into your body. You feel charged, energized, and it helps you get self-confidence. Similarly, just as the Shiva Mudra energizes you and empowers you, gives you more energy, the Durga Mudra, the Bhairavi Mudra, calms you down. Suppose you're having a panic attack or an anxiety attack, or you're very stressed about something, you're fidgety. This is a good way of sitting or waiting so that it helps calm your system. So this would be the left hand over the right hand. Here. Shoulders, arms at shoulder level. This way we are not going like this or like this. It's here, straight. And do it for about 50 seconds. Each time you can do it for 20 seconds and do it in a round of 5. This is the Bhairavi Mudra. The Ganesha Mudra. Since we are talking about the gods and goddesses of our mythology, and it will help you remember these better. The Ganesha Mudra, you clasp your left hand, this is your left hand, with your right, like this. Your right hand is in front. Here you clasp, and as I said, no shoulder droops, no stooping, straight here. Ganesha Mudra is directly related to your nervous system, directly related to your respiratory system. And you breathe better, you feel better, and you keep nervousness, anxiety, and tension at bay. It also pumps in blood and oxygen into your respiratory organs. This is the Ganesha Mudra. See? The right hand and the left hand, and clasp them together. Hold it in a clasp. Now we go on to the Vishnu Mudra. As you know, Vishnu holds the Shankh and the Chakra. So we are going to do the Shankha first. Here is your left hand. Right hand comes in, holds the left thumb, then goes round and touches the ring finger like this. This is the Shankha, Vishnu Mudra Shankh, and this helps your cardiac muscles, helps your respiratory muscles, and helps your kidneys. And because see, this is being pressed. The thumb of the right hand is being pressed to the ring finger of the left hand. So this channelizes energies, unleashes energy and oxygen into the various channels of your body, and is part of mudra healing. Once again, I'll show it to you here. Left hand, right hand, left hand thumb, right hand holds it like this, goes around and presses it to the ring finger. This is the Shankha Mudra of Vishnu. If you remember your Holy Trinity, Brahma, Shiva and Vishnu, you remember there the mudras related to them that help heal your body and energize you. This is the Shankha Mudra. Similarly, the chakra is very easy. Open up your palm. Here we go. This is the left hand. This is my left thumb. Right hand. Right index finger is pressing upon the left thumb like this. And this is the chakra. This helps your thyroids. This helps your sinusitis. And this really helps your liver function better. The power of your fingertips, the power of the mudras should not be taken lightly, and if it is done consistently, it creates a lot of well-being, not into your mind only, but it heals your body. It helps fight problems like diabetes, cholesterol, high blood pressure, and thyroid. So here is your chakra. Chakra of Vishnu. Left hand, right hand. Right hand, this is the left hand thumb, right hand index finger. This is the chakra. Next, we will conclude with 2 more mudras. One is the bronchial mudra. The bronchial mudra, here is your finger. Press your middle finger to your thumb fold in your little finger and your ring finger, and here you point out. The index finger is pointed like this. This is a very strong mudra. It's also known as the Vajra mudra, the Vajra of Indra, the king of gods, as you know. I'm relating it to mythology because then you remember it better. And this is the Vajra mudra or the bronchial mudra, which has direct effect on our bronchial system and helps soothe the bronchial system, averts bronchial attacks, bronchial allergies, and is very effective to help you breathe better, to not suffer from anxiety, depression, and here it goes, the bronchial mudra. I'll show it to you once again. Your middle finger and your thumb press to each other. The little finger and the ring finger are folded, and your index finger is pointing out like this. This is your bronchial mudra. The last mudra that I do with you is known as the asthma mudra. Hold your hand, press your right hand over left hand, all the fingers coordinated like this, see. Then fold in the middle finger of both hands so the second knuckle presses against each other. Here you go. Here. And press it here. Here you go. Hold it like this or like this. All the fingers are pressed to each other and the middle finger are folded so that the second knuckle of one is pressed to the second knuckle of another. Here is your asthma mudra, which helps you breathe better and keeps your respiratory tract clear. Press it to each other and that's it. And last of all would be your Namaskar mudra, what we do Namaskar, but this is the Pranamasana, the Pranam mudra. This should not be underrated because besides greeting each other with respect, we always say respect to you and respect to us back, respecting yourselves and respecting others. It has a lot of healing qualities in your body. For example, your chest muscles work better, your chest muscles are strengthened. All your fingers pressing against each other like this, it helps your spine health better, it helps your nervous system better, and it helps you breathe better. That would be all for today. I hope you all had a good yoga session. It would be wonderful if you could repeat this every day to strengthen your lungs, to breathe in better. And remember, keep your windows open. If you can't be in an open space in the urban communities, keep your windows open so natural oxygen in your room will be recycled and help you live and breathe better. Your lungs are your trees within your body. Take care of them with your yogas by keeping your windows open. And in the environment, the lungs of the earth are the trees. Make sure trees in your neighborhood are not cut down. And if you can, do plant a couple of more trees so we keep our natural reserve of oxygen perfect. We keep Mother Nature and Mother Earth perfect. Thank you very much. See you again next Sunday.
A very warm welcome to Panacea. We have today with us Dr. Rupam Pathak, who is a counseling psychologist. So she'll be taking a session on psychiatry and mental health wellness, on how to keep our mental health balance, which is very important during this pandemic situation, as people are going on with a lot of turbulence in terms of anxiety, mental health problems. So I hand over the session to you, ma'am, and I will get back to you in some time following up your session.
Thank you, Pooja. Thank you for introducing me. Friends, आज का ये जो वेबिनार है हमारा, ये वेबिनार मेंटल हेल्थ को लेकर, ह्यूमन वेलबींग को लेकर है। और इस वेबिनार को हमने करंट सिचुएशन से जोड़ा है। जैसे कि हम सबको पता है, हमारे आज की जो सिचुएशन है, हम सब एक वैश्विक महामारी से गुजर रहे हैं, कोविड-19। लगभग 1 साल हो चुका है हमको इस महामारी से स्ट्रगल करते हुए, लेकिन पिछले 1 महीने से इस महामारी ने और भी ज्यादा विकराल रूप धारण कर लिया। पिछले 1 साल से हम एक डर के साए में रहते आ रहे थे, यानी कि इस महामारी में जो इमोशन हमने सबसे ज्यादा फील किया है, जो इमोशन सबसे ज्यादा एक्सपीरियंस किया है, वो इमोशन है डर, एंजाइटी। और पिछले 1 महीने से जिस तरह से इस कोविड ने कहर बरपाया है, उसमें उसके बाद ये इमोशंस डर और एंजाइटी के साथ हमें पेन और ग्रीफ भी देकर जा रहा है। आज के वेबिनार में हम इन्हीं 4 टॉपिक को लेंगे। हमको कैसे कोविड-19 में, इस पेंडेमिक की सिचुएशन में डर से सामना करना है, अपने एंजाइटी को कंट्रोल करना है, और कैसे हम अपने पेन से, अपने जो नियर और डियर वन है, जो पेन या ग्रीफ से गुजर रहे हैं, हम उनको कैसे कंट्रोल कर सकते हैं, हम इस पर बात करेंगे। अगर हम बात करते हैं डर की, तो फ्रेंड्स, डर की बात हम पिछले 1 साल से, जब से कोविड आया है, तब से सुनते आ रहे हैं। डर लग रहा है, कोविड तो नहीं हो जाएगा, खांसी आ गई, डर लग रहा है, अरे कहीं कोविड तो नहीं होने वाला है। डर मतलब कोविड आने के बाद, कोविड-19 आने के बाद, ये पेंडेमिक की सिचुएशन आने के बाद हम इस डर को बहुत सुन रहे हैं। तो क्या इसका मतलब है डर पहले नहीं था? हाँ, डर पहले भी था। कैसा डर था? कि कहीं कुछ गलत तो नहीं हो जाएगा, कहीं एक्सीडेंट तो नहीं हो जाएगा, आगे क्या होगा। यानी कि डर पहले भी था, लेकिन अभी जो सिचुएशन है उसमें डर बढ़ गया है। आप इस डर से कैसे निपटे, या इस डर को हम कैसे कंट्रोल करें? तो सबसे पहले हम डर को समझते हैं, डर क्या है और डर कैसे काम करता है। देखिए फ्रेंड्स, जब हम इस दुनिया में आते हैं, तब हमारे साथ 2 चीजें आती हैं। पहला है हंगर और दूसरा है डर। हंगर क्या? अगर हंगर नहीं है, भूख नहीं है, तो हम ग्रो नहीं कर पाएंगे, हम बड़े नहीं हो पाएंगे, हम तो वहीं पर ही मर जाएंगे। तो हंगर समझ आया कि हंगर क्यों है, डर क्यों है। जैसे हंगर का रिलेवेंट है कि हंगर हमारी ग्रोथ के लिए जरूरी है, वैसे ही फिर डर का रिलेवेंट कैसा है? डर के लिए तो हम अक्सर सुनते हैं ना, डरो मत, डर बुरी बात है, डरना गलत बात है, डरना डरते कायर है। तो डर लेकर फिर हम क्यों जन्म लेते हैं? हम समझते हैं इस बात को पहले। एक्चुअली डर हमको कब लगता है और क्यों लगता है? डर हमको उस सिचुएशन में लगता है जब हम अपनी लाइफ के लिए थ्रेट महसूस करते हैं। हमको लगता है ये जो सिचुएशन है, ये हमारी लाइफ को खतरे में डाल सकती है। हम ये महसूस करते हैं कि अगर हमने इस सिचुएशन का सामना नहीं किया, या ये जो करंट सिचुएशन है, ये हमारे लिए लाइफ थ्रेटनिंग का काम कर सकते हैं, तो हमको डर लगने लगता है। जब हम छोटे होते हैं, तो जो सिचुएशंस होती हैं, जो प्रॉब्लम्स होती हैं, या जो नए लोग होते हैं, वो हमारे लिए अननोन होते हैं। हम अपने माँ पापा के अलावा किसी को भी नहीं जानते। तो कोई अननोन केस आता है, हम डर जाते हैं कि कहीं ये हमारे लाइफ थ्रेटनिंग के लिए, लाइफ थ्रेट तो नहीं करेगा, ये हमारे लिए कोई डेंजर क्रिएट तो नहीं करेगा। हम डर जाते हैं। फिर धीरे धीरे माँ बोलती, नहीं ये बुआ है हमारी, ये मौसी है हमारी। हम उस फेस से सिमिलर होते हैं, यानी कि हम अपने डर को काबू करते हैं और आगे बढ़ते हैं। यानी कि डर ने क्या किया? डर ने अलार्म बजाया, डर ने बताया कि ये सिचुएशन, ये व्यक्ति, ये परिस्थितियां हमारे लिए डेंजर क्रिएट कर सकती है, हमारे लिए खतरनाक हो सकती है, और हमारा जो अंदर का बायोलॉजिकली सिस्टम है, या हमारी जो सेल्स है, वो उस डर से लड़ने के लिए एक्टिव हो जाते हैं। मतलब क्या समझ आया कि देखा जाए तो जिस तरह हम डर से डरे हुए हैं कि डरो मत, डर कायरता की निशानी है, अगर हम साइकोलॉजिकल पॉइंट ऑफ व्यू से देखें तो डर तो हमारी लिए अच्छा काम कर रहा है। डर क्या कर रहा है? डर हमको बता रहा है कि ये डेंजरस सिचुएशन है, इसमें तुम्हें हेल्प चाहिए। तो फिर ये क्यों कहा जाता है कि डर गलत है या हमको नहीं डरना चाहिए, डर कायरता की निशानी है? फ्रेंड्स, यहाँ हम साइकोलॉजिकली फियर की जब बात करते हैं तब हम यहाँ आपको ये बताना चाहेंगे डर दो तरीके का होता है। पहला यूजफुल फियर, तो दूसरा हेल्दी फियर और दूसरा अनहेल्दी फियर। हेल्दी फियर क्या है? हेल्दी फियर है जब डर यानी फियर हमको क्वेश्चन कर रहा है, हमको कंसर्न कर रहा है, हमको रेशनल थिंकिंग के लिए अलर्ट कर रहा है या रेशनल थिंकिंग के वजह दे रहा है। अनहेल्दी फियर क्या है? जो हमको एंशियस कर रहा है, जो हमको नेगेटिव थिंकिंग के लिए मजबूर कर रहा है। यानी कि डर किस तरह के हुए? दो प्रकार के। पहला डर हुआ अनहेल्दी डर और दूसरा हुआ हेल्दी डर। यानी कि डर जरूरी है। क्यों जरूरी है? क्योंकि हम उस डर से कंसर्न है, हम उस डर से क्वेश्चन है, हम उस डर से अलर्ट है। जैसे इस पेंडेमिक की सिचुएशन में हम नहीं डरे तो क्या करेंगे? मास्क नहीं लगाएंगे, सैनिटाइजर का यूज नहीं करेंगे, कॉशन नहीं रखेंगे, डिस्टेंस नहीं रखेंगे, जैसे पहले घूमते थे फिरते थे वैसे ही करेंगे। ये डर ही है ना जो हमको क्वेश्चन, हमें कंसर्न कर रहा है, हमको रेशनल थिंकिंग के लिए मजबूर कर रहा है कि अगर हम नहीं डरेंगे तो हम बीमार पड़ सकते हैं, हम इन्फेक्टेड हो सकते हैं। ये है हेल्दी डर। यानी डर से हमको नहीं डरना है। कब तक? जब तक कि वो डर हमको कंसर्न के लिए मजबूर कर रहा है, वो डर जब हमको रेशनल थिंकिंग के लिए मोटिवेट कर रहा है, वो डर जब हमको कॉन्शियस कर रहा है। अब हम बात करते हैं अनहेल्दी डर की। अनहेल्दी डर क्या है? एक्सेसिव डर। अगर हम बहुत ही कॉमन वर्ड्स में बोले तो यही डर जब हमको अधिक मात्रा में इंटरफियर करने लगे हमारे थ्रेटनिंग अलार्म को, या कहना चाहिए जो अलार्म था ना जिसने हमको कॉन्शियस किया, जिसने हमको कंसर्न किया, उसको बराबर पुश करने लगे, बराबर नॉक करने लगे, तो हम उसको कहेंगे एंशियस। हम एंशियस हो गए, हमको नेगेटिव थिंकिंग हो रही है। जैसे हमने मास्क लगाया है क्योंकि हम डरे हुए हैं, हमने प्रिकॉशंस लिए हैं, हम अनावश्यक बाहर नहीं जा रहे हैं, हम हाथ सैनिटाइज कर रहे हैं, हम प्रॉपर हाइजीन का ख्याल रख रहे हैं। उसके बाद भी रह रहे कि हमको ख्याल आ रहा है कि कहीं हमको कोविड तो नहीं हो जाएगा, कहीं हमको इन्फेक्शन तो नहीं हो जाएगा। मैं उस व्यक्ति से मिला था, मैंने मास्क तो लगाया था लेकिन फिर भी मुझे इन्फेक्शन तो नहीं हो जाएगा। यानी कि ये जो डर है ये हमारी रैशनल थिंकिंग को इरेशनल बना रहा है। कैसे? WHO की गाइडलाइन के अकॉर्डिंग अगर आपने मास्क लगाया है, आप सैनिटाइजर का यूज कर रहे हैं, आप डिस्टेंस मेंटेन कर रहे हैं, तो आपको इन्फेक्शन होने के चांसेस बहुत कम है। लेकिन उसके बाद भी बिना किसी कारण के, बिना किसी सिम्टम्स के हम बस सोचे जा रहे हैं कि कहीं हमको डर तो नहीं हो गया, हमको कहीं कोविड तो नहीं हो गया, कहीं हमको कोविड हो तो नहीं जाएगा, कहीं हमको कोई बीमारी तो नहीं आ जाएगी, हमको हल्की सी खराश हो गई और हमने बोला अरे कोविड तो नहीं हो गया। ये डर क्या है? ये है एक्सेसिव डर। ये डर क्या है? अनहेल्दी डर। अनहेल्दी डर हमारे अलार्म सिस्टम को अनावश्यक रूप से एक्साइट करता रहता है और हम मेंटली इल होते जाते हैं। यानी कि अभी हमने समझा कि डर कैसा है, इसका नेचर कैसा है। डर अनहेल्दी भी होता है, हेल्दी भी होता है। तो हमको किस डर के साथ रहना है? हमको रहना है हेल्दी डर के साथ, जो हमें क्वेश्चन, कंसर्न और रेशनल थिंकिंग के लिए मोटिवेट करता है। हमको दूर किससे रहना है? हमको निगेटिव या अनहेल्दी फियर से दूर रहना है, जो हमको एंशियस बनाता है। फ्रेंड्स, यहाँ पर आगे बढ़ने के पहले मैं आपको मेंटल हेल्थ और हेल्थ से जुड़ा एक के बारे में कुछ बताना चाहूंगी। देखिए, होता क्या है ना, मोस्टली क्या होता है ना, हेल्थ को हम समझते हैं कि हम बीमार नहीं, हमको कोई रोग नहीं है, हमको डायबिटीज नहीं है, हमको सर्दी जुकाम नहीं है, हम हेल्दी, हमको कोई प्रॉब्लम नहीं। लेकिन अगर हम आचार्य सुश्रुत के अनुसार हेल्थ की यानी स्वास्थ्य की परिभाषा को देखें तो उन्होंने कहा है स्वास्थ्य माने जो अपने आप में स्थित है। और इस स्वास्थ्य को परिभाषित करते हुए उन्होंने बताया है कि स्वास्थ्य का मतलब होता है शारीरिक स्वास्थ्य और मानसिक स्वास्थ्य का समन्वय, संतुलन। अगर आप शारीरिक रूप से स्वस्थ हैं लेकिन आपके मन में कई तरह की चिंताएं हैं, आपके मन में कई तरह की स्ट्रेस है, आपके मन में कोई दुख है, इसका मतलब है कि आप मानसिक रूप से स्वस्थ नहीं है, तो आप स्वस्थ नहीं कहे जा सकते। आगे आचार्य सुश्रुत ने बोला है कि शारीरिक स्वास्थ्य और मानसिक स्वास्थ्य एक दूसरे को पूरी तरह से अफेक्ट करते हैं। यानी किसी कारणवश आपका अगर शारीरिक स्वास्थ्य बिगड़ता है तो थोड़े दिनों के बाद पूरे चांसेस हैं कि आपका मानसिक स्वास्थ्य भी बिगड़ जाएगा। लाइक अगर आपको डायबिटीज हुई है या आपको वायरल है तो आप धीरे क्या होगा कि आप चिंता में रहने लगेंगे, आपका स्ट्रेस बढ़ेगा क्योंकि आपका डेली रूटीन हैम्पर हो रहा है, आपकी फिजिक में उतनी ताकत नहीं है जो आप परफॉर्म कर सके पहले के जैसे। यानी कि आपके शारीरिक स्वास्थ्य ने आपके मानसिक स्वास्थ्य को बिगाड़ दिया। ठीक वैसे ही अगर आपको किसी तरह की कोई चिंता हो रही है, आप को अपने ऑफिस में किसी प्रकार का कोई स्ट्रेस है, आपका फैमिली एनवायरनमेंट अच्छा नहीं है, आप किसी फ्यूचर में होने वाले इंसिडेंट के लिए रेस्टलेस है या परेशान है, यानी कि आप मानसिक रूप से उत्तेजित है या मानसिक समस्या से ग्रसित है, तो पूरे चांसेस हैं कि आप शारीरिक रूप से भी अस्वस्थ हो जाए। जैसे कि आप बहुत ज्यादा स्ट्रेस ले रहे हैं, चिंता करते हैं, तो चांसेस है कि आपका ब्लड प्रेशर हाई हो जाए, चांसेस है कि आपका कोलेस्ट्रॉल बढ़ जाए। यानी कि शारीरिक स्वास्थ्य और मानसिक स्वास्थ्य दोनों एक दूसरे की पूरक है। अब हम यहाँ बात कर रहे थे डर की। जब तक डर ने हमको कॉन्शियस किया, कंसर्न किया, तो हमने क्या किया? अपने फिजिक का ध्यान रखा, अपने शारीरिक स्वास्थ्य का ध्यान रखा। अब ये एक्सेसिव हो गया, यानी अनहेल्दी फियर की तरफ चला गया और वहां पर हम इरेशनल थिंकिंग करने लगे, हम एंशियस हो रहे हैं, हम ज्यादातर निगेटिव थिंकिंग कर रहे हैं। तो आचार्य सुश्रुत या जो स्वास्थ्य की जो परिभाषा है उसके अकॉर्डिंग हमारे फिजिकली इल होने के चांसेस बढ़ गए या हो जाएंगे, क्योंकि शारीरिक स्वास्थ्य और मानसिक स्वास्थ्य एक दूसरे की पूरक है। एक बिगड़ेगा दूसरा अपने आप बिगड़ेगा। यहाँ पर हमको डर, हेल्दी डर और अनहेल्दी डर को समझना है कि जब तक हमको कोविड नहीं हो रहा, जब तक हमारे अंदर कोविड के सिम्टम नहीं आ रहे, तो हमको अनहेल्दी डर तक ही सीमित रहना है। अनावश्यक अनहेल्दी डर के पास नहीं जाना है, हेल्दी डर तक अनहेल्दी डर आपको बताएगा कि ये हो जाएगा। क्या हो जाएगा? जो अभी तक नहीं हुआ। तुमको कोविड हो जाएगा, तुम मर जाओगे, तब बच्चों का क्या होगा, मेरे बिना ये क्या होगा। यानी डर का जो या एंजाइटी का जो यहाँ स्वरूप है वो कैसा है, फ्यूचर में है ना। और फ्यूचर माने क्या है? जो अभी नहीं हुआ। और फ्यूचर में ये जो पॉसिबिलिटीज है कोविड होने की या मरने की या किसी भी तरह की, ये कितनी प्रोबेबिलिटी है कि ये हो जाएंगी? कितनी ना होने की प्रोबेबिलिटी? 50% ना होने की है और 50% होने की है, क्योंकि कोई नहीं कह सकता कि होगा कि नहीं होगा। लेकिन जब हम अनहेल्दी फियर की बात करते हैं या अनहेल्दी फियर पर जाकर खड़े हो जाते हैं, तब हम उस 50% को नेग्लेक्ट करते हैं जो ये कह रहा होता है कि आपको कोविड नहीं होगा। हम फोकस कर रहे होते हैं या परसीव कर रहे होते हैं उस 50% पॉसिबिलिटी को कि हो जाएगा, और उसमें भी हम इमेजिन करने लगते हैं कि वो वर्ष होगा, और वर्ष क्या होके हम ठीक नहीं होंगे, होके हम मरेंगे, और उसके बाद भी वो होगा जिसके जो हम सोचना नहीं चाहते। अरे बच्चों का क्या होगा, या हमारी जिम्मेदारियों का क्या होगा। मेरे ख्याल से हेल्दी फियर और अनहेल्दी फियर के बारे में जो मैं बताना चाह रही हूँ, या हमको कहाँ पर स्टैंड करना है फियर को लेकर के, वो क्लियर होगा। यानी कि हमको हेल्दी फियर को बनाकर रखना है ताकि हम स्वस्थ रहें, और अनहेल्दी फियर एंजाइटी और निगेटिव थिंकिंग को कंट्रोल में रखना है। हमको डर को साथ में लेके चलना है। हमको कभी ये नहीं बोला मत डरो कोविड से, डेफिनेटली डरो, क्योंकि ये बहुत ही वर्स्ट सिचुएशन हो सकता है इन्फेक्शन, लेकिन हो ही जाएगा, ये किसी भी तरह की 100% श्योरिटी नहीं है। श्योरिटी क्या है कि अगर आप हेल्दी फियर के साथ हैं, आप कॉन्शियस हैं, आप कंसर्न हैं, आप रेशनल थिंकिंग आप कर रहे हैं, तो आपको होने के चांसेस काफी कम है। क्लियर? अब हम बात करते हैं कि अगर हमको डर होता है या हमको डर लगता है तो किस तरह के सिम्टम्स होते हैं। फिजिकली सिम्टम्स भी होते हैं और इमोशनल सिम्टम्स भी होते हैं। हम ये कैसे पता लगाएंगे कि हमारा डर हेल्दी है या अनहेल्दी है? कुछ सिम्टम्स है, समझिएगा, ताकि हम पता लगा पाएंगे कि हमारा जो डर है वो कहीं अनहेल्दी तो नहीं हो गया। पहला कि आपकी जब आप कोविड के बारे में या पॉसिबिलिटी के बारे में सोच रहे हैं या कंसर्न हो रहे हैं, तो आपकी हार्ट बीट बढ़ रही है। अगर आप अनहेल्दी फियर में हैं तो डेफिनेटली आपकी हार्ट बीट बढ़ जाएगी, आप स्वेटिंग होने लगेगी, नमनेस, हाथ पैर ठंडे होने लगेंगे, ठीक गरम गरम महसूस होंगे। इसके अलावा ब्रीथलेसनेस होने लगेगी। ये किसकी सिम्टम्स हैं? जब हम अनहेल्दी फियर को परसीव कर रहे हैं, जब हम अनहेल्दी फियर में को लेकर के ज्यादा भयभीत हो। क्या क्या होगा, मैं फिर से एक बार दोहराती हूँ। हार्ट बीट इंक्रीज होगी, नमनेस, हाथ पैर ठंडे लगेंगे, ठीक जो है गरम गरम महसूस होंगे। ये सब सिम्टम कब है? जब हम अनहेल्दी फियर को परसीव करते हैं। इसके अलावा कुछ साइकोलॉजिकल सिम्टम्स भी होते हैं। वो सिम्टम्स कैसे हैं? हम कंफ्यूज होने लगेंगे। अक्सर ये देखा गया है जब हम अनहेल्दी या फियर में होते हैं या स्ट्रेस में होते हैं या एंशियस होते हैं तो हमको खुद भी नहीं पता पड़ता। लेकिन मोस्टली अगर हम गौर करें अपने बिहेवियर पर तो हम समझ पाएंगे कि हम स्ट्रेस में हैं या हम फियर में। जैसे कंफ्यूजन, फॉरगेटफुलनेस, हम कंसर्न नहीं कर पाएंगे, कॉन्सेंट्रेट नहीं कर पाएंगे। हम जिस चीजों के लिए यूज्ड टू थे, जो हम बहुत इंटरेस्ट के साथ करते थे, हम उनमें मन नहीं लगा पाएंगे। ये कौन से सिम्टम हुए? ये सिम्टम हुए साइकोलॉजिकल सिम्टम, यानी अनहेल्दी फियर के ये साइकोलॉजिकल सिम्टम हुए। अब बात होती है कि ये सिम्टम्स क्यों हो रहे हैं, तो मैं इस मैकेनिज्म को थोड़ा समझाना चाहूंगी आप लोगों को। देखिए, हमने अभी आपको बताया था हम लोग आए हैं इस दुनिया में दो चीज को लेकर के, एक हंगर और दूसरा फियर। फियर क्यों? क्योंकि हमारी लाइफ थ्रेटनिंग जितने भी सिचुएशंस हैं उससे ये हमको बचाता है, उससे ये हमको जो है सतर्क होने के लिए कहता है। जब हम बड़े हो जाते हैं तो हमारी फियर की जो रीजन्स हैं, जो सोर्स हैं, वो चेंज हो जाते हैं। जैसे जब छोटे होते तो भूत का डर होता है, मम्मी पापा छोड़ के ना चले जाए। फिर थोड़े बड़े हो गए तो एग्जाम का डर हुआ, फिर तो नहीं हो जाएंगे। फिर थोड़े बड़े हुए तो जॉब का डर हुआ। अब जो सिचुएशन है, जो पेंडेमिक की सिचुएशन है, ये सिचुएशन है कहीं कोविड नहीं हो जाए। तो जब इस तरह की थ्रेटनिंग सिचुएशन आती है और हम अनहेल्दी फियर को परसीव करते हैं, तो क्या होता है कि हमारा जो दिमाग है, जहाँ पर ये थिंकिंग हो रही है, वो बहुत ज्यादा काम कर रहा होता है, क्योंकि हम कंटिन्यूअस उस डर के बारे में सोच रहे होते हैं जो निगेटिव होता है। इसका नेचर निगेटिव है, इसकी कैरेक्टरिस्टिक्स निगेटिव है, तो दिमाग को लग रहा है कि डेफिनेटली कुछ गड़बड़ हो रही है और हमको बचाना है। जैसे होता है ना कि घर में कुछ गलत इंसान घुस रहे हैं तो हम लोग किस पोजीशन में आ जाएंगे कि घुसने नहीं देंगे, एंकर आ जाएगा और तैयार हो जाएंगे कि उसको निकालना है। ठीक वैसे ही जब हम अनहेल्दी फियर परसीव कर रहे होते हैं तो हमारी पूरी बॉडी तैयार हो जाती है कि नहीं, जो भी ये थ्रेट आया है, जो भी ये सिचुएशन आई है, इससे बचना है। तो अभी दिमाग जल्दी क्या कर रहा है? थिंकिंग कर रहा है, सोच रहा है। तो जितनी भी हमारी बॉडी की जो सिस्टम है वो उस दिमाग को और एक्टिव कर रहा है ताकि ये रिलैक्स हो सके। टेंशन में, फियर में है। तो होता क्या है, जब दिमाग ज्यादा काम कर रहा है तो वहां पर या जो है पार्ट, हमारा बॉडी और पार्ट ज्यादा काम कर रहा है, तो वहां पर उसको एक्टिव करने के लिए ज्यादा ब्लड सप्लाई चाहिए। तो पूरी की पूरी ब्लड सप्लाई कहाँ गई? दिमाग की तरफ गई, तो यही तो ज्यादा सोच रहा है, यही तो थ्रेट बता रहा है ना। तो क्या किया कि हार्ट को भी अब जल्दी जो है पंप करना है ब्लड, ताकि सप्लाई ऊपर जाए या जहाँ जरूरत है वहां जाए। तो क्या होता है कि हार्ट बीट बढ़ गई। क्यों बढ़ी? क्योंकि हमने परसीव कर लिया कि थ्रेट सामने है, जो है नहीं। अनहेल्दी फियर की बात कर रही हूँ, हमने परसीव किया, हमारी जो है हार्ट बीट बढ़ गई। अब क्या हो रहा है, हार्ट बीट बढ़ी क्योंकि पंप कर रहा है ब्लड ज्यादा, हार्ट ज्यादा पंप, हार्ट जो है ब्लड को जल्दी पंप कर रहा है। अब होता क्या है, जितना ब्लड हमारे शरीर में है वही तो काम करेगा, वही तो सर्कुलेट होगा। ऐसा तो नहीं है कि बाहर से कहीं से ब्लड आएगा। तो हाथ पैरों में जो जा रहा है ब्लड, वो सारा ब्लड एक जगह जा रहा है जहाँ पर इसकी जरूरत है। ब्लड सब जगह से जल्दी से लेकर के हार्ट ब्लड को उस पर्टिकुलर एरिया तक पहुंचा रहा है। कहाँ से? हाथ से, पैर से। तो अब हाथ और पैर से जब उसने ब्लड को खींचा तो हाथ पैर क्या हो गए? ठंडे हो गए। ये होता है नमनेस या ठंडे होना, जहाँ पर गर्म लगने लगा। ये क्या है? फिजिकली सिम्टम है, जो मैंने अभी आपको बताया। हमारा हार्ट जल्दी काम कर रहा है और अनावश्यक प्रेशर क्रिएट हो रहा है। ये है अनहेल्दी फियर के इमोशनली और साइकोलॉजिकल सिम्टम। कैसे हमारा ब्रेन या कैसे हमारा जो शरीर है, इंटरनल बॉडी स्ट्रक्चर है, कैसे फियर का सामना करता है। अब इसी फियर से जुड़ा हुआ है एंजाइटी या एंसियस होना, जो मैंने अभी बताया था। उसमें क्या होता है, ऑलवेज हम सोचते हैं निगेटिव आउटकम, वो भी प्रेजेंट से रिलेटेड नहीं होता। हमेशा एंजाइटी या एंसियस जो थॉट होते हैं वो फ्यूचर से रिलेटेड होते हैं। जैसे अभी हमने बताया कोविड तो नहीं हो जाएगा, कोविड हो जाएगा तो हॉस्पिटल में बेड मिलेगा कि नहीं मिलेगा, फिर ऑक्सीजन मिलेगी कि नहीं मिलेगी, फिर कहीं मैं मर तो नहीं जाऊंगी, कैसा है इसका नेचर, सब फ्यूचर टेस्ट में जाऊंगा, मिलेगी कि नहीं, हो नहीं जाएगा, यानी ईच एंड एवरीथिंग रिलेटेड विद फ्यूचर नॉट प्रेजेंट। और इमेजिनेशन में है, अभी तो सिम्टम भी नहीं है, अभी तो एक्सपोजर भी नहीं है। और इस समय हमारे दिमाग ने क्या किया, इरेशनल थिंकिंग स्टार्ट कर दी, रेशनल थिंकिंग भूल गया। क्या है रेशनल थिंकिंग? सबसे पहले WHO की गाइडलाइन क्या कहती है, अगर आपको इन्फेक्शन हो भी जाता है तो आपको केवल 14 डेज उस वायरस के साथ स्ट्रगल करना है। अगर आपने 14 डेज उस वायरस के साथ स्ट्रगल कर लिया तो आप ठीक हो जाए। और ये भी एक फैक्ट है जो बताया जा रहा है कि रिकवरी रेट 99% है, केवल 1% ऐसा है जो लॉस कर रहे हैं। और हम इरेशनल फियर में क्या कर रहे हैं, इसी 1% में फोकस कर रहे हैं। हम क्या कर रहे हैं, 99 यानी जो फैक्ट है, जो रेशनल थिंकिंग है, हम इमेजिन नहीं करके चल रहे हैं कि हम उसी 1% में है, जबकि अभी वो भी ये जो 99 और 1 का जो रेशियो है वो कब है, जब कोविड-19 में आप इन्फेक्टेड हो रहे हैं तब। यानी कि अनहेल्दी फियर ने क्या किया, रेशनल थिंकिंग को गायब ही कर दिया, कोई मतलब ही नहीं है फैक्ट से, बस इमेजिन करना है, वो भी बुरा बुरा। अब हम बात करते हैं दूसरे फैक्ट कि अगर एक्सपोजर हो जाए और आपको कोई सिम्टम नहीं है, आप एक्सपोज हो रहे हैं किसी कोविड पॉजिटिव व्यक्ति के साथ, तब आपको केवल 10 दिन, जो नई गाइडलाइन है उसके अकॉर्डिंग 10 दिन उस सिम्टम्स को देखने हैं। अगर नहीं हो रहा है तो बहुत ज्यादा चांस बढ़ जाते हैं कि आपको इन्फेक्शन नहीं होगा, लेकिन फिर भी हम कहाँ फोकस कर रहे हैं, क्या होगा, हो तो नहीं जाएगा, हम इन्फेक्टेड तो नहीं हो जाएंगे, एंजाइटी। उसके बाद बहुत ढेर सारे साइकोलॉजिकल, इमोशनल और फिजिकल प्रॉब्लम। स्टडी बताती है कि अगर हम डरते हैं तो अभी मैंने बताया कि किस तरह से हमारी बॉडी रिएक्ट करती है। हमारी बॉडी क्या कर रही है कि वो इमेजिनरी फियर के साथ फाइट कर रही है, तो फाइट तो उसकी चल रही है, तो डेफिनेटली हमारा सिस्टम थकेगा, इमेजिनरी जो है दुश्मन के साथ लड़कर, तो डेफिनेटली जब सच में ऐसी सिचुएशन आएगी तो क्या होगा, वो तो थका है, तो उस पूरी ताकत के साथ वो रियल डेंजर के साथ फाइट नहीं कर पाएगा। मतलब क्या कि अगर हम मानसिक रूप से एंशियस हो रहे हैं या डर रहे हैं या अनहेल्दी फियर को परसीव कर रहे हैं तो हमारा इम्यून सिस्टम कमजोर हो रहा है। ये एक बहुत बड़ी वजह है हमको हेल्दी फियर की तरफ तक ही सीमित रहने का। अगर हम अनहेल्दी फियर के साथ जा रहे हैं तो डेफिनेटली हम अपने इन्फेक्शन होने के या इन्फेक्टेड होने के चांस को बढ़ा रहे हैं। तो क्या करना है हमको, हेल्दी फियर के साथ रहना है। अब हम बात करते हैं एंजाइटी की या फियर की, या समझ लीजिए हमको डर लग रहा है तो हमको क्या करना चाहिए। इसके लिए एक एक्टिविटी है, मैं आपको ब्रीफ कर रही हूँ, आप करिएगा, करने की कोशिश कीजिएगा। आपको कुछ नहीं करना है, जो मैंने अभी बताया, अगर आपको अनहेल्दी फियर परसीव हो रहा है, आपको समझ आ रहा है कि आपकी बॉडी अंदर ही अंदर किस ढंग से रिएक्ट कर रही है, आप सोच रहे हैं, करना चाह रहे हैं कि आप प्रेजेंट में आ जाए, आप इस अनहेल्दी फियर से बाहर आ जाए, लेकिन नहीं आ पा रहे हैं, तो क्या करें, कुछ मत कीजिए, आप बैठ जाइए चेयर में, स्ट्रेट बैठ जाइए, कमर सीधी कर लीजिए और अपने हाथों को इस ढंग से रख लीजिए। और कहाँ रखेंगे इन दोनों हाथों को? नाभि के पास, वो दो। अगर आप आंखें बंद कर सकते हैं, आंखें बंद कर लीजिए। नहीं कर सकते तो आंखें खोलकर कोशिश कीजिएगा बंद करने की। क्या करना है? इनहेल, एक्सहेल। सांस को होल्ड नहीं करना है, अपनी ब्रीथ को होल्ड नहीं करना, जस्ट क्लोज योर आईज, टेक अ डीप ब्रीथ एंड रिलैक्स। इनहेल, अब इसके साथ साथ क्या करें? जब आप इनहेल कर रहे हैं, जब आप ब्रीथ ले रहे हैं, आप काउंटिंग स्टार्ट कर सकते हैं। 1 2 3 4 5 6 7। जब आप एक्सहेल कर रहे हैं तब आप काउंट कर सकते हैं 7 6 5 4 3 2 1। माने जब आप ले रहे हैं तो 1 to 7, जब छोड़ रहे हैं तो 7 to 1। ये भी नहीं कर पा रहे तब सांस लीजिए। जब जा रही है आपकी श्वास अंदर, तब आप उस श्वास का, उस ब्रीथ का पीछा कीजिए। कैसे पीछा कीजिए? इमेजिन कीजिए कि अंदर जा रही है, आप मानसिक रूप से उसके साथ साथ जाइए यहाँ, और जब वो बाहर निकल रही है तब यहाँ पर गरम गरम महसूस कीजिए। आपका जो अनहेल्दी परसेप्शन है वो हेल्दी परसेप्शन में चेंज होने में, हेल्दी फियर परसेप्शन होने में हेल्प करेगा। अब हम बात करते हैं एंजाइटी। जब हम बहुत ज्यादा नेगेटिव हो रहे हैं, बहुत ज्यादा प्रॉब्लम हो रही है, हम अपने थॉट्स को कंट्रोल नहीं कर पा रहे हैं, नेगेटिव सोच रहे हैं, सोचे जा रहे हैं, सोचे जा रहे हैं, सोचे जा रहे हैं, फियर हमारा पूरी तरह एंजाइटी में चेंज हो गया, तब क्या करें? उसके लिए भी 5 स्टेप हैं। चाहे तो लिख लीजिए, चाहे तो मेरे साथ करिए। ये जो एंजाइटी की जो चेन है ना, ये एंजाइटी की चेन क्या होती है ना, कि एक बार शुरू होती है तो वो कहाँ तक जाती है ये हम सोच ही नहीं सकते। और कैसे शुरू होती है, इसके लिए तो हमको डरने की भी कभी कभी जरूरत नहीं होती। जैसे हम सुन लेते हैं ना कि आज वहां एक अनहोनी हो गई, तो हम इमेजिन करने लगते हैं अगर ये मेरे साथ हो जाए, उसने अपना पिता खो दिया, क्या होगा? मेरे पिता खत्म हो जाएंगे, क्या होगा जब वो नहीं रहेंगे? हमको पता है मेरे पापा जहाँ है सुरक्षित है, अच्छे हैं, स्वस्थ, उन्हें कोई प्रॉब्लम नहीं है, लेकिन हम उस इमेजिनरी वर्ल्ड में चले जाते हैं जो हमने सुना होता है या जो हमने नहीं चाहते, हम उस वर्ल्ड में चले जाते हैं और उस थॉट को या उस चैन को स्टार्ट कर देते हैं, करते जाते हैं, करते जाते हैं। बस एक ट्रिगर चाहिए। कभी कभी ये ट्रिगर नहीं भी हो, हम ऐसे ही बैठे बैठे, क्योंकि हमारी जो है मानसिकता ही हो गई है अनहेल्दी फियर में विचरण करने की, यानी इमेजिन करने की। मन है नकारात्मकता की तरफ ज्यादा ही जल्दी अट्रैक्ट होता है। खैर, कैसे हम इसको कंट्रोल करें? पहला स्टेप है इंटरप्ट। इंटरप्ट माने जैसे ही आपकी जो चैन स्टार्ट होती है नेगेटिव थिंकिंग की, आप अपने आप को इंटरप्ट कीजिए। बताइए, अरे ये क्या कर रही हूँ, ये क्या सोच रही हूँ, खुद बोलिए, अरे ये क्या सोचा मैंने, मेरे साथ नहीं हुआ है, ये सब सही है, अभी ठीक है। इंटरप्ट कीजिए अपने आप को। जैसे जब कुछ गलत करती है ना बच्चे, क्या करती है, ये क्या कर रही है तुम, कैसे बैठी है तुम? छोटे छोटे बच्चे होते हैं ना, झुक के बैठते हैं, छोटे छोटे बच्चे होते हैं नाखून खा रहे होते हैं या पैर हिला रहे होते हैं या कुछ भी ऐसी एक्टिविटी कर रहे होते हैं जो अच्छा नहीं हम लोग समझते हैं, तो वो क्या क्या कर रही हो तुम? तो बच्चा कॉन्शियस हो जाता, नहीं करता। यानी कि फर्स्ट स्टेप क्या है, हमको इंटरप्ट करना है अपने आप को ही। फिर सेकेंड स्टेप क्या है, ब्रीथ। जो ब्रीदिंग पैटर्न अभी बताया उसको भी हम फॉलो कर सकते हैं, या फिर जस्ट यहाँ गर्म महसूस कीजिए, फॉलो कीजिए ऊपर, या काउंटिंग स्टार्ट कीजिए 7 to 1, 1 to 7, इनहेल एक्सहेल के साथ। 2 स्टेप्स हो गए। पहला क्या है, इंटरप्ट, अपने आप को इंटरप्ट। कैसे, जैसे हमारे कुछ गलत करने पर हमारे पेरेंट्स हमको करते थे, या कुछ गलत करने पर हम अपने बच्चों को करते। इंटरप्ट हो गया, ब्रीथ हो गई। थर्ड है कि रिमेम्बर। क्या रिमेम्बर कराना है कि हम इस सिचुएशन को कैसे हैंडल कर सकते, कैसे हम हैंडल कर सकते। लाइक जैसे हमें एंजाइटी हो रही है कि कहीं हमको कोविड नहीं हो जाए, और हम नेगेटिव थिंकिंग कर रहे हैं, तो नहीं, हम मास्क लगाएंगे, हम सैनिटाइजर लेंगे, हम जो है हाइजीन का ख्याल रखेंगे, और हम इस तरह इस सिचुएशन को हैंडल कर सकते हैं। हम बहुत अनावश्यक बाहर नहीं जाएंगे, यानी कि किस तरह इस सिचुएशन को जो हमें एंशियस बना रहा है उसको हम कंट्रोल करें। अब हम बात करते हैं, बहुत ही इम्पोर्टेंट ये स्टेप है, इसको हम बोलते हैं अपने आप को ग्राउंड करना। ग्राउंड माने आप जहां बैठे हो, अभी आप कहाँ चले गए हो, फ्यूचर में, है ना, हो जाएगा तब क्या करूंगा, कैसे रहूंगा, मर जाऊंगा, यानी ये जितनी भी प्रोसेस है थिंकिंग की, वो कहाँ जा रही है, फ्यूचर में। तो ग्राउंड योरसेल्फ कैसे, बी प्रेजेंट, आप अपने आप को प्रेजेंट में लाइए। कैसे, सबसे पहले अपने 3 सेंस का यूज कीजिए। कौन कौन से, सी, हियर और स्मेल। उन 3 चीजों पर फोकस कीजिए जो आप देख पा रहे हैं। बोलिए मेरे साथ, जो आप 3 चीजें देख पा रहे हैं। लाइक जैसे मैं देख पा रही हूँ टीवी, मैं देख पा रही हूँ पेड़, मैं देख पा रही हूँ फैन। अब 3 चीज जो आप स्मेल कर पा रहे हैं, मैं स्मेल कर पा रही हूँ खाने की स्मेल, परफ्यूम की स्मेल भी है, किसी ने पूजा की है वो स्मेल भी आ रही है अगरबत्ती की और हवन करने की। दिस ईयर, ईयर्स से क्या कर सकते हैं, वो 3 आवाज जो आपके आसपास है, लाइक बाहर से कोई गाड़ी जा रही है, फैन चल रहा है उसकी आवाज, वॉशिंग मशीन ऑन है उसकी आवाज। यानी कि एंजाइटी का जो चेन है उसको तोड़ने का जो ये टेक्निक है वो क्या है, तीनों सेंस से हमको 3 चीजें बोल करके अपने आप को रियलाइज करना है कि हम प्रेजेंट में हैं। 3 चीजें जो हम आंखों से देख रहे हैं, 3 चीजें जो हम कानों से सुन रहे हैं, 3 चीजें जो हम इसमें कर पाते हैं। और इन सब से, इन चारों स्टेप से भी ज्यादा इफेक्टिव जो टेक्निक है वो है जर्नल। जर्नल माने मेंटेन या राइटिंग डायरी। जब भी आपको एंजाइटी हो रही है, जब भी आपको नकारात्मक ख्याल आ रहे हैं, जब भी आप एंशियस हो रहे हैं, जब भी आपको अनहेल्दी फियर परसीव हो रहा है, एक डायरी लीजिए और जो जो थॉट आ रहे हैं वो आप लिखते जाइए। कैसे कि जब हम सोच रहे हैं तो वो कहाँ जा रहा है, हमारे दिमाग में रह रहा है। जब हम लिख रहे हैं तो क्या हो रहा है, दिमाग से, हाथों से होता है वो, पेन में क्या हो रहा है और कागज पर क्या हो रहा है कि वो शब्द के थ्रू आकार लेकर के हमारे दिमाग से बाहर जा रहा है। बहुत ही इफेक्टिव टेक्निक है, कर देखिए, डेफिनेटली ये उसी समय आपको आराम करेगा और बहुत जल्दी आप अनहेल्दी फियर से और एंजाइटी से बाहर आ जाएंगे। देखिए दोस्तों, अभी तक हमने जो बात की है वो कोविड-19 के फियर और एंजाइटी को लेकर बात की है, लेकिन इस बार जो लहर आई है, ये पेंडेमिक की सेकेंड लहर जिसको हम बोल रहे हैं, सेकेंड वेव जिसको हम बोल रहे हैं, वो सच में ही बहुत भयानक है। फेसबुक देखिए, फोन देखिए, व्हाट्सएप ग्रुप देखिए, रोज हम सुन रहे हैं कि हमने या किसी ने अपने नियर एंड डियर वन को खो दिया। बहुत ही पैथेटिक सिचुएशन है, लेकिन जीना तो है ना हमको। और ये सिचुएशन ऐसी सिचुएशन है कि हम इससे कैसे आगे बढ़े, क्योंकि लॉस और ग्रीफ पहले जैसा नहीं रह गया।
मैम, मैं बस यहाँ पे आपको बोलना चाहती हूँ कि हम लोगों का टाइम थोड़ा सा कंस्ट्रेंट जा रहा है। सो आज हमें यहीं पे ख़त्म करनी पड़ेगी ये सेशन। बहुत ही अच्छा और बहुत ही इट्स अ वेरी इंफॉर्मेटिव सेशन जो आपने किया है। डर का जो इतने सारे सेगमेंट्स है लोगों तक पहुंचाना, ये भी मतलब थैंक यू वेरी मच फॉर दैट। एंड हमारा हर मंथ एक सेशन होता है साइकाट्री का। एंड आप मैम इसके ऊपर अगर लिखना चाहते हैं तो प्लीज लिखिए। हम इनको पब्लिश करेंगे हमारे ई हेल्थ मैगजीन में, और उसके साथ साथ हम लोग इसको एक इंटरव्यू के तौर पे भी लेंगे हमारे पोर्टल्स पे, जो है जो आपको मिलेगा panacea.inexonline.com में। Thank you so much, viewers, for being with us in this session today. And I will definitely get in touch with you. And ma'am, I will get in touch with you for further questionnaire session.
Okay.
Thank you so much.
Thank you.
A very warm welcome, everyone, to Panacea. As you know, that we are helping in overcoming the post-COVID-19 and tuberculosis, anxiety, treatment, and mental health for a long time now. And today we have with us from Government of Assam, Dr. Gautam Borgohain, who is a WHO consultant, and along with that we have Dr. Paranjay Bordoloi. I welcome you both, sir, to the session today, and we would like to know a lot about the kind of work which the Government of Assam is doing on in eradicating tuberculosis in times of COVID-19. We would like to hear it from you, sir.
Yeah, actually, as many of our audience are already aware of, like TB treatment in government facility is free of cost. We have actually the name of the program has recently changed. Earlier it was revised National TB Control Program, but now it has been after in last 2 years it has been changed to National TB Elimination Program, and under this program, all the TB patients all over India, their sputum diagnosis is free of cost. Then, if after the diagnosis, if they are positive, then their treatment is completely free of cost from the government side. And it's not only in Assam; it's for entire pan India. It's same. And I would also like to include one more, very pertinent test in regarding tuberculosis, which is CBNA test, and it's very costly if you go to the private health facility. But for anybody who comes in the government health facility, and this CBNA test is also done free of cost. So it's a general information. Whoever comes with TB sign and symptoms in TB, if they are coming to any health facility, and they will be provided free sputum examination, and then also X-ray facility in some of the civil hospital. Mostly in all the civil hospital in Assam, X-ray is done free of cost for the patients, including TB patient also. And then in some of the good health centers, it is also free of cost. So X-ray and sputum, and then also CBNA, that is completely free of cost. And more specifically, the medicine for DSTB, drug sensitive TB patients, and as well as drug resistant TB patients, which is also free of cost. And as you have pointed, one pertinent point like how we were coping in regarding COVID environment. See, it's a very challenging situation for each one of us, including our like health staff, not only the doctors, our nurse, our STS, senior treatment supervisor, and all other TB staffs who are working in the TB as well as for other health program. So basically, after last year, there has been instruction from our state TB cell, like when the first COVID comes into our state, then we encourage our staff to provide the medicine, make it available to the patient home. And normally our protocol is the patient has to come every day for treatment for doc center. Earlier it was doc center, now treatment support center. So instruction has been given that medicine can be made available and we can give medicine for more number of days so that patient will not have to come every day. So that is point number one. And point number two, regarding side effect and all other things, we have one particular NGO, that is G, which is particularly working for private TB patients. But after COVID, we have instructed them to provide telephonic counseling not only to the private TB patient but also to the government TB patient. So that's from like those kind of arrangements have been made. And also I would like to request our Borgoy side to like add few more points regarding this.
Yes, so if you would like to say something, sir, on this.
Yeah, thank you so much. So, as you all know that during this crisis of COVID pandemic, we have also initiated something called bidirectional screening. Bidirectional screening means the COVID patients or the presumptive COVID patient cases who have similar symptoms like TB. TB also has symptoms of cough, fever. So we are putting up an effort to screen all those COVID cases for TB also, which is called bidirectional screening. So that is something which is helping us to detect more and more TB cases. So that is the initiative which we have recently taken, and that has helped us a lot. So that is what I wanted to add to what Dr. Paramjit said.
Sir, if you could tell us about what is causing tuberculosis to spread in this, and what is the current scenario of number of patients who are currently being treated for tuberculosis.
Okay. So see, the current scenario is like your first question. I would like to answer your first question first. So regarding the spread of the disease, so there are various factors, especially in Assam among the tea gardens. You can see the living conditions, malnutrition, and some social and behavioral habits like alcoholism. So there are different patterns of, there are different dynamics. So that is one, and of course other things like, of course, in the last few years we have taken portion of it. The cough hygiene, the basic cough etiquettes, which people doesn't follow. So as you know, it's an airborne infection, and there are too many crowded places, too many slums around, and the tea garden areas. So that is the place where TB can spread easily. So that is a factor which is maybe causing increase in the TB case, and also the drug resistance TB which we have recently seen because of people not taking standard regimen, or not taking appropriate medication, or not completing the treatment for the entire duration. So that has also contributed to drug-resistant tuberculosis. And the second reason, annually we are treating almost around 30,000 to 35,000 TB cases in Assam. And of course, the treatment success is also quite good. We are able to treat around 90% of the TB patient. But again, the spread of the infection has to be restricted or limited. So that is a challenge which we are facing, and that needs support from the various stakeholders. As you know, TB is no longer only a health issue; it has become a social issue. So the collaboration and cooperation from multiple stakeholders is very, very important. Administrative commitment, and then support from NGOs, partners. Of course, media has got a very important role to play in terms of creating the correct, giving the correct messages to the community, creating awareness. So those are just a few of the, pillars, or I would say, which can help us go for TB elimination by 2025.
Yeah, just a few more things I would like to add with what I said. Basically, one general message should be there that in India, almost 40% of our adult population have the TB bacteria in their body, and having that bacteria does not mean that it will develop as a disease, but due to, as he has rightly pointed out, due to malnutrition, due to any other comorbidity condition means like if the patient is suffering from diabetes, HIV, or any other cancer or any other disease. So that due to that also, and including that, if there is any kind of somehow his or her that particular in that body immunity will be low, then only this bacteria which cause TB will make it as a disease. So basically that generally people feel like TB is more in India. First thing, our population is like we have second largest population in entire world. So that means our population is bigger. So that means that why number will be there, and also as per the different research has been done, and almost 40% of our people are infected with that bacteria, but that does not mean that they will develop the disease. But due to some kind of as I have earlier mentioned, that some kind of if their immunity will be compromised, then only it will develop in a disease. So that's why we are focusing more on one particular aspect. Strategy is early detection of the cases is important. Why it is important? That means if we detect the case early, and then only that particular particular patient will get the treatment after maybe 1.5 months. If he or she is regularly taking the medicine, he will not be able to spread the disease to like other person. So that transmission will be cut. So that is point number one. And point number two also, the one strategic message these days we are collaborating with our TB message. That means like not only the TB patients, like we request all our public that they should avoid like tobacco related products to take if they are consuming alcohol, they are consuming cigarettes and all other like smokeless tobacco product also, that somehow actually help the disease to help the infection develop as a disease, because these kind of tobacco products help reduce their immunity in their body. So that's why the people will be two things. We request them to do two things. One is if they are suffering from any kind of TB symptoms like cough for 2 weeks, then weight loss, night sweats, and like appetite loss. If they are finding any kind of these symptoms, they should come voluntarily and done their testing. They can do it in the government health facility where it is free of cost, and if they are going to private also, in private hospitals this facility is available, but then they have to pay for it. But they have to come early for the detection, and they don't have to be panicked if they are detected as a positive. Then we have a full spectrum, like we can take care of their emotional thing, counseling and all other aspects, and also the medicine will be given free of cost.
Absolutely, sir. That is a really great initiative. If you can also highlight a little bit about the testing of HIV patients, and also if anything the team is doing on anti-tobacco, if there is any kind of campaign going on, or if there is any plans of doing that in the future. If you can please tell us about that.
Yeah, I would like to mention here that there is a strong collaboration between the National TB Elimination Program and the Tobacco Control Program, and also the National AIDS Control Program. at all levels, at the national level, state level, and at the district level. So usually, all TB patients are screened for HIV. That is a mandate now. That is a government of India policy. So all TB patients should be screened for HIV, and vice versa. All HIV patients who are having symptoms of TB must be tested for TB. So it's a kind of both-way screening. Similarly, all TB patients, like Dr. Prananda has mentioned, tobacco consumption is a risk factor. So all TB patients are being counseled for counsel against users of tobacco. And similarly, if there is any symptoms of TB among tobacco users, they are immediately referred for testing. So that collaboration is strongly there at all the health facility at the district level. And also there is certain, I would like to say, committees, which we mentioned, like committees in terms of for monitoring and supervision purpose and for implementing the guidelines. So we have a state level TB comorbidity committees, which is basically a committee formed between the TB program and the HIV. They have representative from the TB program and HIV, and also tobacco, and even some other non-communicable diseases. So we have certain committees at the state level and also district level TB comorbidity committees. So there also we have representative from the TB program, from the tobacco, and from the AIDS control program. So that collaboration is there, and we are also using the latest technology, CBNAP, that is the gene expert technology, for testing of all these high risk patients. We call them high risk, HIV or tobacco. So for testing this patient using this new technology called gene expert or CBNAP, so that we don't miss out on any case, we don't fail to detect any case, and it is very sensitive, very rapid, and we can easily detect any comorbid condition. So that is the system which is there in place. But again, the people needs to be aware of this system, and they need to come forward to seek the service. The health-seeking behavior of the people of the community should be addressed. They should come forward, demand the services which is available under the program, and also we should also look into the quality of the services. So like I have mentioned, the collaboration is there between the TB and HIV and TB and tobacco, and all the testing facilities are also there. And also I have also mentioned here, we have a kind of one roof. All the services are being provided under one common roof. Like if a HIV patient goes to an ART center, the ART center for the management of HIV, it doesn't need to go to other health facility for taking TB, for management of TB. So suppose a patient is having TB and HIV also, he can avail all the treatment related facilities, even the diagnostic and also treatment services under one roof. So he can collect the medicine from the ART center itself. The patient doesn't need to move around here and there to collect the medicine. So we have this facility, all the facility under one roof. The patient, so it's easier for the patient to get all the medicine for TB as well as for HIV in the ART center and in one common hospital setup. And those are some of the facility system which we have in place.
Yeah, and also one of the best practices recently which have been done by the program. Earlier, now I can say for the state of Assam, all our district TB officers are the nodal officer for HIV program, as well as in most of the district, they are also now looking after the tobacco control program. So why I would like to mention here that, so that means all these programs at the district level where they have to be accessed by the patient directly, their one leadership is maintaining all these three programs. So that means two basic advantages there. One is if there is any kind of leadership issue or any kind of direction issue regarding services available at the periphery, so that means only one person can take the decision. That is point number one. And point number two, it is helping us regarding the coordination. Coordination means like if tobacco program is organizing any kind of awareness meeting or any kind of public activity, then it's very easy because the nodal officer is the same, so that message from the TB as well as message from the HIV can come combined. So it's a more kind of a package thing for the public. So it's as Borgoy sir has mentioned, now it's the community, they need to be a little bit of, take the ownership and take the services. And when we say community, we actually encourage, like recently we are taking up, two, basic strategy. One is all the community health officers. In Assam, we have around 2,000 community health officers. They have been sensitized over, virtually in different almost 8 VCs, video conference regarding TB services, and they have been, inculcated the message of the TB HIV, TB tobacco, TB, diabetes. So that have been given to them. So they are now posted at Health and Wellness Center, where they are the first point of the contact. So that can be, thus these messages can be easily percolated to the community. That is one. And the other aspect is, now the program has been identifying TB champions. When we say TB champions means they are the cured TB patients. So they have come through all this journey, being a victim of the disease. They survived from the disease with the support of the government, and now we have been sensitized them, trained them to take the ownership and take the, build a relationship with community and make them as a bridge to so that more patients will access the service. This TB champion has been trained, and now we are encouraging them to identify cases from the community, take the cases to the government health system, where the nearest health facility, and then if this patient has been diagnosed as a TB patient, then we encourage this TB champion to become as a treatment supporter for this particular TB patient. Why it is important? Because then this TB patient who is taking medicine from a cured TB patient automatically see a role model who is there in front of him every day, and then it will help him to build up his emotional well-being, as well as we encourage this TB champion to counsel this TB patient regularly. So that is a very good initiative we are trying, and we hope that this will actually make a paradigm shift result in coming days, not only in Assam, but we are hopeful that will really result the TB, make a big change in TB scenario in India.
Absolutely, I totally agree with you on that. Sir, if you can also elaborate a little bit about the supply chain management and the policy interventions in the state about TB.
Yeah. So before I go to that supply chain management regarding the supply of drugs and logistics, I'd also take this opportunity and through your channel to convey one message to the people regarding the prevention part. Because prevention is very important, as we all know. So for prevention, beside the cough etiquettes, which is very similar to COVID, cough etiquettes, wearing of masks, we have also got some preventive medicine, especially for HIV, people living with HIV. So the preventive medicine is available in the ARD center, which any people living with HIV can avail. So I'd like to convey this message, and also for children. Also for the children below 6 years, they are preventive medicine. So I'll convey this message to all so that they come forward to avail this preventive medicine. So regarding the supply chain management, the drugs and logistics, we have got a very robust system. Okay, the drugs are usually procured at the national level by Government of India, and is it then supplied to the state governments, and from the state it goes to the district, and from the district it goes to the sub-district level. So there is a very robust mechanism, and also we are using a online online web called Nikshay Oshadi. Nikshay Oshadi, which is the online system. So the Indian and the issue and all those, so we are using that online Nikshay Oshadi portal for the issue and indent of medicine, and there's a dashboard in Nikshay Oshadi which will tell us the stock position throughout the entire state, to the entire country, in the whole of facility, what is the drug stock position, It will also tell us if there is any short expiry drugs. It will also tell us if there is a requirement of drugs. So this next-generation portal is we are using, and of course, like the supply of all the and in case of some emergency, if suppose Government of India fails to procure the drug due to some emergency, then there is also provision for procurement of the drugs at local level. I mean, at the state level or at the district level. Of course, with the formal approval from the Government of India. And I will also mention here that the drugs which is procured for the anti-TB drug which is procured by the Government of India is of the topmost quality, in the sense it's under high quality assurance system. Okay, there is a pre-procurement quality assurance mechanism, post-procurement assurance mechanism, and then we do some random sampling after the distribution of drugs to the state and the district. We do some random sampling. We collect the drugs from the field and do quality testing. So quality is of the highest. I mean, it's a priority for the program. It's of the highest quality. And also, I would like to know that the manufacturer is all the international good pharmaceutical agencies. Manufacturer the one of the best pharmaceuticals like Kedila, so the quality is not a compromise. We have got the highest quality, the best quality of anti-TB drugs in the program.
Yeah, and also one more thing. I think many of it is a very general message for the patient taking TB treatment in the private health facility. I would like also to inform all of you, patients who are taking TB treatment in private health facility. Now, program has come to offer the medicine for private TB patients free of cost at their wherever that particular doctor or hospital wants. If they want to keep that medicine for their private TB patients at their chamber or at their clinic or at their hospital, then government is providing that facility free of cost. Or otherwise, if they start it as a home, like we have this now we call it like family docs. Family doc means that medicine can be given to the family. Any one of their family member can be recognized as a treatment support center, and the drugs will be given to patient home. So that facility is also available. So as Dr. Bhagwai sir has pointed out, the quality of the TB drugs entire India is is based in the medicine is provided by the government, and now public as well as the private patients, they can also avail the facility of this medicine free of cost, and that is really important not only to the private TB patients but also for the doctors as well as like pharmacists treating TB patients in private health facility. They can actually take this government medicine at their respective centers, and they can provide it free of cost to the TB patient. Why it is important? So that the government is doing it because we do not want from the government side that somehow for the like interruption of the TB treatment, whether it's in the public or it's in the private. So that is really important. And also you have mentioned about the policy intervention. As you are already aware, like from the diagnostics, like laboratory part, it's latest technology is provided, including CBNAT is provided free of cost. Then also in particularly we can say for the state of Assam that we have intermediate reference laboratory, which is one of the sophisticated BSL lab, which is in the government medical college, Guwahati Medical College, and patients are offering services free of cost, and all that is for the lab part. And we have almost 450 designated microscopy center in the government institutions where these free sputums are done for the TB patient in Assam. And also we have tie up with some NGOs where their health facilities we are providing support, and then this sputum test is given free of cost for the patients coming to this NGO hospital. So that is the lab part, and also for the medicine part, people are already here, like best quality medicine for the public and the private, we are providing it free of cost. And regarding the other aspect of the policy, we have a active case file, like we have advocacy, communication, and social mobilization activities like different kinds of community awareness meeting, patient provider meeting, sensitization meeting, training is ongoing, and also we have like facility, as we have mentioned, like community engagement, like engaging TB champions, PRI members into the system, so that more services, quality services can be reached by the TB patient of different areas, even including tea gardens, hard to reach areas. So that is all aspect. And one is very pertinent changes after these main changes. So earlier it was control, where we focus more on the passive mode. Patients are coming to us and we are treating the patients. But now, after this elimination mode, we are focusing more on the active case finding, which is really one of the paradigm shift in the policy of TB treatment in India, where we are going to reaching out, vulnerable population. When we say vulnerable population, who are vulnerable population? One is healthcare providers. We are reaching to them. That is point number one. And then we have tea garden workers in Assam. We have brick workers. We have tribal population. We have slum population. So these different categories of vulnerable population of clinical vulnerability, then also like social or financial vulnerability. So this kind of mapping has been done at the district level, and we are going actively. Active case finding means we are visiting their locality, their household. We are screening their people, these people, and identifying if they are having any sign of symptoms. Then we collect the sputum there, and then we done the test. And if the positive comes, then patient don't have to come to the hospital. The result will be given to them, and also the medicine will be given to them either by ASA or Anganwadi worker or TB champion or family docs, or identifying anyone in their locality so that they can be reach out and they can take the medicine at their convenient time, convenient location, free of cost. So that's really one of the important aspects, and we encourage all people to support in our active case finding, campaign. Not only in Assam but also entire, it's going on in entire India. So we want more number of volunteers to come forward and help us, especially during this active case finding drives. Yeah.
Absolutely, sir. That is really, really wonderful. If you can, as you were talking about the treatment, if you can also elaborate a little bit about the infrastructural condition right now at the hospitals for treating TB patients and along with COVID-19 patients. And also, like, we are introducing, like, during this pandemic, we were introduced to the digital transformation. The usage of digital, like telephonic conversations and on everything, telemedicines, everything. So if you can elaborate a little bit about the future of the situation in India, about how the kind of treatment can be done digitally.
Okay. So regarding the existing infrastructure for the diagnosis of tuberculosis, all the health facility with a microscope and a laboratory technician should be doing the test for, should be doing the test for diagnosis of tuberculosis. So basically, all existing health facility in Assam or in India, whenever there is a microscope and a laboratory technician, they'll be able to diagnose tuberculosis. Second is the facilities which you have mentioned just now, the newer technology, the CBNAT, the Gene Expert, the TrueNet machine. So this technology, these machines are provided in some of the identified or in some of the selected health facilities like district hospitals, medical colleges. So those district hospitals and medical colleges are capable of diagnosing the TB patients for the treatment purpose. And of course, we have also got a system of collection of samples and transportation of samples. So in case a patient is not being able to travel to the testing facilities, there are provision for collecting the samples from the patient's residence or at the periphery, and it can be transported to the testing facility. Then Regarding the treatment part, as you know, TB treatment is completely decentralized now. Only if the case is complicated, then we need to hospitalize the TB patient. Otherwise, it is decentralized in the sense the patient can avail the treatment at his residence, at his home, which Dr. Porando had just mentioned, family doc. So any family member can be sensitized or trained or build up the capacity to give the medicine to the patient at the residence itself. Otherwise, the TB patient may be linked to the ASHA or the community volunteers for treatment purpose. The basic idea is that the treatment is delivered at the doorstep. But if it is a complicated case, then of course we have to refer to the nearest district hospital. Otherwise, it's a completely decentralized, and usually most of the TB patient is a domiciliary treatment. Most of the TB patients are being treated at their home or at under their respective health facility, and can be easily managed. So regarding the future, of course, we are using some digital technology. I'll name something. To name some of them are, one is 99 dots, one is MERM. So these are some of the digital technology coming up in the program, which will monitor the treatment compliance and the treatment adherence of TB patients. So these are basically some mobile-based technology or ICT-based technology which the program is using. And also at the same time we are having a toll-free number. Toll-free number, we call it Nikshay Sampark, where patient can call up that number for any TB-related information or grievances. So those things are here. Now the program is planning to go for artificial intelligence, AI technology also. That is but very initial stage. We are still planning at the planning. Of course, some of the places we are piloting. Even we are thinking of drone for collection of some sample from the difficult areas and transporting to the testing facility, or supply of drugs to the most difficult places, especially in Northeast, using drones and other artificial intelligence mechanisms are there in the planning stage and it's being piloted. But some of them are like 99 dots and MERM we are already using. It's simply mobile-based technology, 99 dot. The patient has to give a missed call whenever the patient takes the medicine, and some kind of SMS or alert message goes to the patient and also to our district health staff. If the patient is not taking the drugs regularly, then we can retrieve the patient. So it's a kind of missed call or mobile message. But again, I will mention here that it is very initial. We are piloting and we are yet to roll out in the entire state or in the entire country. But of course, digital technology is a very much important part of the program. It is coming up in a big way in the future for the National TB Elimination Program.
Yeah, and I would also like to just give the information regarding Nikshay Sampark call number. It is 1800116666. Again, I am repeating, it's 1800116666, and we are happy that now it's not only in English, it's not only in Hindi, it's almost in most of the regional language, even in Assamese also. If a TB patients or anyone from Assam are calling to that particular number, which is free of cost, and that person can get the information in Assamese also. So that is really important, and I encourage anyone, especially as you have mentioned, now during this COVID time, people will not be, if they are suffering from any kind of symptoms, which they feel like it may be related to TB, or if they want to know more about it, they can actually, without going outside, they can call at this number, and then the information will be available. Like they will be counseled by our trained counselor who is in the other side of the telephone, and then they can receive that service. And after that, if they need to go somewhere, that person, that our counselor over telephone can guide any person. if they needed to go to the health facility. So that is point number one, which is really important. And point number two, now as you have mentioned, like what is the current, how we are doing it in the COVID. Now we have this niche, dashboard. It's an online platform where we encourage, collect all the information, including the telephone number of the TB patients. If the telephone number is not available with the particular TB patient, we ask them to ask him or her to give any number which of their relative or their neighborhood, or maybe if it's not also available, then also the respective ASA. So that telephone number is with us. Then if we see the treatment is not going on, or if you would like to, our staff, district staff would like to communicate, they can communicate over the phone. They don't have to travel. So that is there from our staff side, and also from the patient side also. Now, recently I would like to give this example. In recent last 24th March, we have published in Assam all the district TB officers' telephone number in our almost all the regional reels, both in English and Assamese. So this telephone number is available in the patients or any it's in the public domain. They can call the respective TB officers for any kind of help. So that is also there in place, and also we encourage our staff, as we have mentioned, we have done it in the last year also. We are encouraging our staff, any health staff who is providing TB services, to call their respective TB patients and ask them if they have any side effect or if they are requiring any medicine or anything. So those kind of services are available. So that is current what we have in the system. And also you have mentioned about the futuristic way. I feel like from our aim, I feel like maybe, and also we are using this video platform like Eco platform for providing training. Recently, we have in last week we have trained almost 1,500 community health officers over VC. In 7-8 VCs we have trained them. So that is technology which is available right now, which is we are using from our state TB cell. So that can be we are using it to disseminate the information during the COVID times, train our staff, doctors regarding updating TB information, as well as how they can deal with the patient in COVID scenario. So that is also there. And maybe in long term we can this digitalized platform like your kind of magazine, which will be telecasting this kind of interviews, talk shows in regional language as well, and which can be available in the public domain, and we can actually provide those links to the people or organization. They can actually spread it to the general public as well. So that's maybe one of the area where, because what we see, like if it's in the COVID times, we will not be able to organize meetings in a public way, like physical meetings. So we have to based on this kind of electronic platform, digital platform, but also challenge is how to make it available for the patients coming from very below poverty line, or coming from very hard to reach areas. How we can access this kind of facility to them? I think that will be one of the challenges which will be coming to us in the near future.
Absolutely, sir. It has really been a great experience doing this session with you both, sir. And on the parting note, if you can conclude by saying the kind of second surge which we all are experiencing right now, and the kind of problems of the treatment in India going on right now, with all the patients, a lot of cases coming up also. And if you can tell something in it, and then at an ending note, and aware the mass with the people who are watching us, and how to keep themselves healthy, and in mental health will also be dependable on this physical health. So if you can just tell how the people can stay at home and work on themselves and stay fit as much as possible, avoid going to the hospital.
Okay, that's really a very important question considering this hour of crisis. So, see, there are many things which you can do at home. First, of course, uh, the behavioral, the protective, we must follow the strictly the guidelines for personal protection. Okay, that is always there, even inside the home or outside the home. So that basic behavioral, I will say the basic protection should be always there, or basic hygiene. Like simply, like I don't want to repeat all those simple hand washing, sanitization, wearing of masks, distancing. That is always there. But beside there are other issues, other things or other activities which you can always do at home. Very simple meditation. Simple meditation. We won't ask people to go for very hard, exercise or something like very intense workout. But simple meditation, simple yoga, and communication through using the social media, those things. And also, you have to understand that has given us an opportunity to bring up our family bondings. So it's not that when you stay inside the home, you cannot do some productive work. We should take it as an opportunity to do something for the family and for a profession too. It gives us some time to understand ourselves, to do some productive work, even staying inside the home. Okay, it gives us plenty of opportunity to explore things online or through some other literature. So the main basic idea which I'm going to convey is that we should not take this as a threat. Of course, we have to be cautious. Preventive measures should be always there, but it's not a threat. We should take it as an opportunity to build up ourselves, our family, and the community. And of course, the mental tense that should not be there. It should not be a very tense kind of situation. That mental relaxation is very much important, and all of us know how to do it. There are various ways. I mentioned few: yoga, meditation, and there are other ways also. And you can also have access to different. There are online. Online, you have access to different ways how to use your time. So you can use those online websites which will give you tips to how to utilize your time at home or during this emergency of COVID. So that is what I want to say.
Yeah, actually rightly pointed out. And few more things I would also like to add. First thing is like when that message is going on, like to wear masks, but how to wear masks. Like normally if you see many people are wearing masks like this. This is not the right approach. So if you are wearing mask, it has to cover your this mask. It's like cover your nose. So that should be good practice. So which is wherever we are going in the field, many people are wearing masks, but it's not the right way. So first, my basic advice is that if you are wearing masks, wear it properly, so that it will protect you. So that is point number one. And point number two is, as Bhargava sir has mentioned, like hand washing and cleanliness. So that should be there. So that is point number two. And point number three is, yes, we all need to admit it is a very challenging environment. So how best we can cope it? So most thing is, you have to compromise on basic things. Few of the important. So if you would like to, if I am saying if you are from a upper middle class or a rich class, you have that habit of going out, then you have to avoid it. So that is point number three. And if you are from the below class, like if you are daily earning, so it's very difficult for you to remain home. But I would also like to encourage you, if you have to earlier times, if you are going out and working in 6 days in a week or 7 days in a week, but now you should avoid it 6 or 7 days rather than going out at least 2 to 3 days, so that you can maintain your family with that earning, but you have to compromise on few other things. So that is, you have to know from which layer of the society you are, and then also you will be adopting the current scenarios. And that is advice number 3. And more importantly, how best we can use it. So if you are available, having any kind of radio or these days mobile, you listen to good song in every morning rather than switching on the news in the early morning where you are witnessing a lot of information. Most of them are very negative. Like, see, as a normal people, you don't want to make yourself scientific researcher of COVID disease. You just have to know the basic things. So every morning you don't have to switch on the first thing to the news. Rather than switching on the news, first switch on to the any music channel or any kind of good song you can play. Then also, as Bhargava sir has mentioned, meditation is one thing. If you are not trained in meditation, do some kind of spiritual thing. If you are earlier in India, we have this habit of prayers. So use this platform to doing your stress, like or trauma kind of relief exercise. You can be of any religion, Hindu, Muslim, Sikh, Isai, that does not mean. But do your normal prayer, which according to your religion, which offer you. So do it in every morning and in the evening, because now you have the time, and not only you, and also your like family members. So that is also very good exercise to relieve your trauma or stress. That is one good advice. Then also, if you have in your home, if you have a place where you can walk, then you can do it with limited physical exercise. You don't have to go to the gym. We have seen people are going for gym and all those things, but please avoid it. Do it in your home, physical exercise. Then I think it is good. And if you have any kind of, if you have children at home, play with them. Maybe physical game, not like virtual games, mobile game. I'm saying physical game with them. Build, as he has mentioned, one good thing, like strong the family bonding. Talk with your family members. See how what is their medical condition. Talk some positive aspect also, and more importantly, as he has also mentioned, using social media or any kind of media, you have to be understand how to filter the information. Not only the information, like there are some rumors also going on. So avoid those rumors. You have to filter the correct information, aware of the current scenario, and also take the best help of switching on any kind of there are different channels talking about meditation, talking about different positive aspects. So you have to identify where you will log on and how best you can utilize your time. But try to learn something creative, if painting or any kind of things, which will help you to maintain your time. So that is really important. Don't be panic or create things. And also one more thing, see this challenging time, if you are finding it difficulty, if you are any kind of issue, go and contact your local doctor. He is the best person. You don't have to go out and reach out to a specialist. First contact your local doctor, which is available over the telephone, and talk to him, and if only he advises that you have to consult with a specialist, then only you should consult to a specialist, because you have to also, as a public, should be aware of right now most of the doctors, paramedics from the public as well as in the government, they are busy with this COVID pandemic. So they are also going through a very challenging time. So you have to somehow maintain this, you have to respect this condition, and you reach out to the local doctor if you need for any kind of help. And I believe we all can overcome this, and especially to our TB patients, you don't have to panic. If you are finding any kind of difficulty, drug issues, side effect, contact our health staff, and we all can come together. And if we really follow the norms, then only we can actually end TB by 2025 from India, and we really seek everyone's support for that. Thank you.
Thank you so much, Borgoy sir and Bordoloi sir, both of you, for this wonderful, wonderful session today. And definitely following all the government protocols and guidelines, we will definitely overcome COVID-19 and tuberculosis together. So thank you so much, sir. I'll definitely get in touch with you for further articles and all everything. So since we all are here, so please log on to panacea.eletsonline.com for all the past videos and past sessions on mental health, nutrition, yoga, which all we've been doing since past 6 months now. So I would also like to thank Elets eHealth magazine along with Narayana Health and our sponsorer who is Viatris, a Mylan Pharmaceuticals company. So thank you so much who has been organizing Panacea, and it's been really, really great in collaborating with you. Thank you so much, sir, for your time. Both of you. Thank you so much.